Yes, this is Dr. Malik Rahim, and I want to talk a little bit about case conceptualization. Spend a few minutes talking about that and what does it really entail. I think the first thing you have to do is look at what are case conceptualizations and why there is so much interest in it. A case conceptualization is a method for understanding and explaining a client's concern and for guiding the treatment process. It functions like a bridge to connect assessments and treatment with clinical outcomes. So I think many consider case conceptualizations to be the most important competency in counseling and one of the most challenging to master. So what I want to do is have an introduction on what are case conceptualizations. I think the primary thing is that first we have to define what our case conceptualization. What's the definition of case conceptualization? A case conceptualization is a method and clinical strategy for obtaining and organizing information about a client, understanding and explaining the client's situation and maladaptive patterns, guiding and focusing treatment, anticipating challenges and roadblocks, and helping successful termination. Okay. Now, with this definition, it highlights 5 clinical functions and strategies. And those are obtaining and organizing, explaining, guiding and focusing treatment, anticipating obstacles and challenges, and finally preparing for termination. So those are the key things in this video where I want to talk about with case conceptualization. The next video, we're going to get a little bit more in depth on the strategy for case conceptualization. What are the components of a case conceptualization? Case conceptualization usually consists of 4 key components: a diagnostic formulation, a clinical formulation, a cultural formulation, and a treatment formulation. And all those are key elements to the case conceptualization. The diagnostic formulation provides a description of the client's presenting situation and any triggering factors, as well as the basic personality patterns. So you usually answer the question, what happened, okay? The clinical formulation provides an explanation of the client's pattern, and it usually answers the client question, why? Why did it happen, okay? The cultural formulation provides an analysis of social and cultural factors, and it answers the question, what roles does culture play? Okay, what are the levels of acculturation and stress? Treatment formulation provides an explicit blueprint for intervention planning, a logical extension of the diagnostic, clinical, and cultural formulation. And it usually answers the question, how can it be changed?